Let's explain it from an example. When you go to the hospital and you have sick heart valves, so your heart valves are not opening properly, then a surgeon will replace them. And then if you replace that with a medical device, so with new valves, then actually your body will respond on that. And we call that a physiological response. So in some way it will react. And actually with a virtual patient, we try to mimic that real patient in a computer. And then we put in the medical device virtually, so also in the computer. And we then expect that the physiological response will be the same. So actually we completely make a twin of the patient. I just explained a virtual patient, so it's actually a digital representation of a real human. Now, we have a lot of diversity, a lot of different peoples with different colors of eyes, different hair color, different countries. And actually in a virtual cohort, we try to collect all those virtual patients and make a cohort of it. So a full population of virtual patients. That's actually the definition of a virtual cohort. If we make a model, what we actually do, we know a lot of things based on physics. For example, we know if we have a tube and we pump a volume of mass into the tube, then it will either extend, so it will be stored in the tube, or it will flow out at the other side. That's because of mass conservation. We have the second law of Newton. So if we apply an external force to a body, then you get an acceleration. And those known principles can also be used to, for example, mimic the blood flow. The only thing that we then have to do is to adapt the parameters of those models to an individual patient. And that's what we can do by performing measurements. For example, we know that the resistance depends on the diameter. And we can measure the diameter of an individual patient. So we can feed the models with patient data. And based on that, we can develop models that can indeed simulate the response after we put in such a device. Of course, if we have such a model and it's validated, we can change the parameters, which is actually the variation of diameters in those individuals. And then we create our cohort. So that's actually the approach that we generate.
To create a virtual patient cohort with the same properties as the real population, we have to go through 3 steps. First, parameterize patient from the real population. Second, fit a statistical distribution to this data. And the last one is randomly sample new point from the fitted distribution.
Let's explain these steps with an example. We consider a real cohort of patients with severe aortic valve stenosis. We parameterize each patient with 2 parameters, aortic valve area and the pressure drop across the aortic valve. Now, each patient is represented by a point in a 2-dimensional space, and we can fit a 2D statistical distribution to the points.
Now we can randomly sample new point from the distribution. These points form the virtual cohort. The virtual cohort, by definition, reproduce the same properties as the real cohort because it's the sample from the distribution fitted to the real cohort. This can be achieved by a random sampling from the fitted distribution, then filtering out the sample with the desired parameter values.
So let's go back to the example with the severe aortic stenosis patients. A rare parameter combination is a small aortic valve area with a small pressure drop. Suppose that we want to generate a virtual cohort with only those rare patients. We can sample new points from the fitted distribution and filter out the points that represent the rare cases.
The advantages of using or developing methods for creating virtual patients cohort against real patients data are basically 3. We have an advantage of quantity. Real patients data are often not available or sparse. We have an advantage of quality. We often miss some of the information of the patients which allow to do research as much at the level of granularity that we would like to. And then we have an advantage of compliance with the legislation and regulation, which often preclude us as a researcher from using real-world data. Therefore, virtual patients cohort can really, as generated from the real patient data, can represent them in a safe way and a rich way. We are still in a development phase of the virtual patients cohort, and even if we proved the preliminary potential of using virtual patients cohort against the real world data, we still have to advance in validating them, making sure that they are representative and in line with what we expect from a real cohort of patients. And then we also have to make a huge step toward a sort of translational use. We have to prove and make sure that the use of virtual patients cohort is meaningful to close the circle back to the real world, so that what we find out on the virtual patients cohort is actually meaningful and make a difference on the research and treatment of real world patients. So we still have to make a lot of effort in closing that loop.